Hi friends! Before watching the video, don't forget to subscribe to my channel by clicking the subscribe button below and clicking the bell icon to be notified whenever I publish a new video. Home Remedies presents 15 warning signs of cancer you should never ignore. It is not always easy to be able to realize if you are suffering from cancer or not, if not diagnosed by a doctor. So, there are some signs that you need to pay attention to. If the disease is diagnosed earlier, then the survival rate would be much higher. Still, make sure you know that the signs do not always indicate that you have cancer, but you need to take them seriously. Just pay close attention and visit your doctor if you notice anything unusual. There are over 200 types of cancer. The most common ones are lung, breast, prostate, bladder, ovarian, kidney, colorectal, endometrial and pancreatic cancer, also leukemia and melanoma. Most of the time, the survival rate for cancer is poor, especially when it comes to lung cancer. So let us look at some of the most common signs of cancer. If you experience them, consult your doctor as soon as possible. Signs that could indicate cancer. Unexplained weight loss. One of the first common signs of cancer is weight loss, especially when it comes to solid tumor cancers like lung and breast cancer. When the cancer reaches the liver and stops its normal function, associated with removing toxins and regulating appetite, it causes weight loss. Still, this can be a warning sign of digestive types of cancer like colon cancer. 40% of all cancer patients claim that they experience this at the time of diagnosis, and 80% are experiencing cachexia or general wasting and unexplained weight loss. If you are dieting or exercising, then losing weight is perfectly normal. In other cases, losing up to 10% of your weight or up to 10 pounds a month in a 6-month period is a cause for worry. Fatigue and weakness. If you are getting enough sleep and you are still tired and you feel fatigue and weakness, then you need to consult your doctor as soon as possible. Frequent fevers or infections. Most of the time, if you are experiencing a fever, it means that your body is fighting an infection. So if it is prolonged and it stays for a longer time, then you might have lymphoma. Also, the cancer of the blood cells, leukemia, can cause fever, frequent infections, aches, fatigue and other flu-related signs. Shortness of breath and wheezing. These symptoms can mean different conditions like lung cancer. Moreover, wheezing can be caused by a lung tumor pressing against and narrowing the airway. Chronic cough and chest pain. Lung cancer and leukemia symptoms are sometimes the same as bronchitis and coughing, so this problem might happen from time to time. These symptoms can also be followed by chest pain that will go down the arm or into the shoulder. In these cases, you need to make an appointment with your doctor. Also, if you are coughing and your voice is hoarse for more than 6 weeks, consult your doctor. These symptoms might indicate thyroid, lung, esophageal or laryngeal cancer. Bloating. If you are bloating often and there is no reason for it, then it might mean that you have ovarian cancer, especially if your abdomen is swollen or you have pelvic pain or you are feeling full. Also, bloating and stomach pain after eating might indicate stomach cancer. Chronic heartburn. Most of the time, heartburn indicated acid reflux. Still, if it continues for a longer time, it might indicate esophageal cancer or Barrett's esophagus. In May 2012, the journal Clinic Gastroenterology and Hepatology published a study that claims that chronic heartburn can cause inflammation of the tissue lining in the esophagus, which puts us at risk of esophageal cancer. Bowel issues. If you are experiencing unexplained changes in the bowel habits, then this might indicate bowel cancer. This is especially so in older people. Difficulty swallowing. If you are having problems with swallowing or you are feeling chunks of food in your chest or throat and they even get worse with time, then this might mean that you have throat or esophageal cancer. Moreover, other signs of this cancer can be a burning sensation or pain when swallowing food. Most of the time, esophageal cancer does not show symptoms, but still, do not ignore the ones that appear. Nail changes. Nail changes can happen due to different reasons. Still, they can also warn of skin, lung, or liver cancer. Brown or black spots under the fingernails can be a sign of skin cancer. Enlarged ends of the nails, clubbing of the toes or fingers, can be linked with lung cancer. White or pale nails show a poor functioning of the liver caused by many diseases such as liver cancer. Jaundice. With this condition, you experience yellowing of the whites of the eyes and the skin. Usually it appears as a consequence of gallbladder or liver disease. Still, it can be the sign of pancreatic cancer, and this will disrupt the functioning of the liver and bile duct. Unusual swelling of lumps. If you see a strange lump on your groin, testicle, breast, underarm, abdomen, neck, or another part of your body, and it stays there for more than 3 weeks, then you need to go to the doctor. Sometimes having a lump or an enlarged lymph node under the arm can show breast cancer. Also, swollen, red, and sore breasts can signal inflammatory breast cancer. New or changing moles or skin spots. Many skin changes are not very dangerous and they do not cause pain. However, if you notice the following, you should screen for cancer. New spots, growths, or sores on the skin that are not healing. Changes in color, symmetry, diameter or border of your existing mole. Abnormal bleeding. Blood in the urine can show kidney or bladder cancer, apart from a urinary tract infection. Moreover, blood in stools can indicate bowel cancer, even though it also might mean that you can have hemorrhoids. Usually signs of uterine or endometrial cancer are bleeding after menopause or between periods. Also, vaginal bleeding can mean vaginal cancer. Last but not least, bleeding from the gastrointestinal tract can be a warning of colorectal cancer. Excessive or persistent bruising and bleeding might signal leukemia, and coughing or vomiting, blood, lung, esophageal or stomach cancer. The reason for abnormal bleeding is not always cancer. Still, we need to go for regular screenings and keep healthy. Abdominal or pelvic pain. Lower abdominal or pelvic pain that come together with heaviness and changes in the bowel habits can indicate ovarian cancer. You can develop this cancer more if you are a woman with a family history of ovarian, colorectal, or breast cancer. If you have never been pregnant, you are a woman diagnosed with colon, breast, uterine, or rectal cancer. Moreover, pain in the pelvic area can indicate leukemia or uterine cancer. If you found this video useful, hit that like button to give it more value, and don't forget to share on your social networks so that other people can benefit from it too. Thanks for watching. Goodbye.